You're listening to episode 49, a conversation about supporting families facing illness in the military on the Child Life On Call podcast. Hi, and welcome to the Child Life On Call podcast. When your child is sick, the whole world seems to stop in its tracks. Plans and priorities change, and your number one job becomes figuring out how to get your child well again. For some of us, rest, medications, and relaxation can do the trick. But for others, it takes more. It takes countless doctor appointments, invasive medical testing, therapy, surgeries, the list goes on, and then you still may not have all of the answers or results you were hoping for. This podcast features parents of children that have an illness or medical condition and gives them a place to share their own journeys and experiences. We will talk about the ups and the downs, the highs and the lows, but one thing seems to remain the same. Children are resilient and teach us more about ourselves and the world than we could ever imagine. Thank you so much for lending a listening ear and opening up your heart to these families and this podcast. I'm your host, Katie Taylor.
But we do know that military-connected children have higher rates of special health care needs and behavioral health needs than do civilian children. And so just knowing that for child life specialists is this is an area that needs to be focused on, and that's definitely underserved.
Hello, everyone, and welcome to the Child Life On Call podcast. For those of you joining us for the first time, I'm so excited that you are here and a part of our community now. We share stories from parents who have kiddos that have different medical issues and diagnoses, and just give parents a safe place to share stories, experiences, and connect with one another. Every once in a while, I do a little bit of a different episode in which I gather experts and professionals from the medical field and the pediatric field and different parts of pediatric health. And since November is Military Family Month, today I have the honor of sharing with you my conversation with two military-based child life specialists. Not only does their family currently serve in the military, which we are so thankful for their service, but they also have focused on serving children and families in their regions with their child life specialist hats on. So they've got a really unique perspective that I'm excited for you to be able to hear. So before we get to our conversation, I quickly just want to ask you to join us on Instagram and Facebook, and you can just search Child Life On Call and join in on the conversations that we're having. It's such an open and lovely community, and we do the best we can to give you relevant resources to help you support yourselves and the children in your life. So let's get started with today's conversation. Please meet Lisa McWhorter and Savannah Self. This month, we're going to be featuring families in the military who have children with an illness or medical condition or have been hospitalized for a reason. And both of these child life specialists today have or do work with children in military hospitals. And so I'm excited to have you guys here. And so, Lisa, if you'd like to introduce yourself and talk about where you are in the United States, all three of us are all over the whole country right now. So that's kind of cool. But just tell us a little bit about yourself and your family.
Sure. So I'm Lisa. I am a child life specialist and military spouse. My husband is a pilot in the Navy. We have 3 boys, and we are currently living in Chesapeake, Virginia. We ended up moving down here in the middle of the pandemic. So things were quite crazy. But we're here. We're together as a family. We were not right before we moved. So we are happy to be together.
That perspective is just crazy. So thank you for sharing that. It's true. It's like a move in the middle of a pandemic, but you're together, and that's what's important.
Yeah.
And how about you, Savannah? Tell us about you and your family.
So I'm Savannah. I am married to a Marine officer. He's a combat engineer out here at Camp Pendleton in Southern California. We've been married for almost 4 years. 3 of which of those years I have been a child life specialist. We don't have any children or fur babies or anything like that. We have moved quite often with my husband's officer career journey. So for me, myself, I'm at 7 moves in 3 years. So we've had a lot of transitions as well. But we have had an amazing military journey, and I'm excited to share more about that today.
Oh, wow. Awesome. And so you're both child life specialists. So Savannah, you were kind of just telling us about your past 3 years. I guess tell us about your journey into child life and what you're doing now.
My journey into child life was a little bit non-traditional, but I feel like that's a common story. I was actually going to school for children's ministry, and I thought that child life was only available to pursue as a career journey if you actually went to school to be a child life specialist in a child life program. And halfway through my children's ministry journey, I was like, you know what? Let me look up what it takes to be a children's chaplain in a children's hospital. And so I went on to Children's Hospital Philadelphia's job site and typed in children's chaplain, and up popped child life. And at the time I was a senior in high school, and I was like, what is this?
Mm-hmm.
And so over the next few years, I tried to pursue children's ministry, and then really felt like my passion was in child life. And at the time I was dating my now husband and knew he would most likely be transitioning into the military. And so I started to look at what would that look like as a military spouse to be a child life specialist. And I wasn't aware of the different barriers and challenges that would incur with being so frequently moved. And
Mm-hmm.
so at this point, I am working in private practice to help maintain connections and skills with child life and families who are experiencing illness, injury, hospitalization. And what I've mostly focused on here at Camp Pendleton has been families who are experiencing the transitions of deployment and the cycle that has brought about. And then I very quickly did my student experiences, but had a really hard time finding a child life position with where we were more remotely. The Marine Corps has bases on the coasts, but they're typically far away from a city, and that's where we find children's hospitals. And so
Right.
I've battled a lot of underemployment and unemployment. And Lisa has experienced that, as well as many child life connected military spouses have also experienced. That's been my journey.
Wow. Something you said at the beginning is like, I think a lot of child life specialists that I have spoken with have had that same experience. It's like almost that love at first sight. It's like you didn't
Mhm.
know that you wanted to be a child life specialist, and then you saw either a description or you met one or you were in the hospital and one of them supported you and you're like, you are what I want to be. It's like a lot of us have that kind of instant connection that's like, wow, just changes the course of the rest of your life.
Absolutely.
But and so how about you, Lisa? Why don't you tell us about your journey into child life and what you're doing now?
Similar to Savannah's story on several different levels, I also had graduated from college and was working, not in anything related to child life, and was looking for child life, except I didn't know what it was at the time. So I was looking into occupational therapy and came across child life specialist as I was Googling different programs and looking into graduate programs. So I found child life and realized that's exactly what I wanted to do. I just had no idea there was a whole entire profession
Hmm.
dedicated to this field. So I went back and got my master's in child life and family centered care from Wheelock College in Boston, which is where I was living at the time. And that's kind of how things got started. Before I got my first child life job, I did some volunteer work in Cape Town, South Africa,
Wow.
which was incredible on all levels.
Hmm.
Personally, traveling to South Africa was amazing. And the work, just working internationally with a child life program that was newly existing in this hospital was really awesome. So when I returned from that experience a few months later, I ended up finding my first child life job at a rehab hospital. So
Okay.
again, kind of similar to story, I feel like I've ventured into child life on a sort of non-traditional role as
Hmm.
well. So I've worked in rehab and several other non-traditional child life settings. We have also moved 5 times as a military family, and most of those moves I've been able to work as a child life specialist. I've worked, like I said, in rehab, and that's actually where I met my husband. I was living in Boston, and he was in Jacksonville, Florida at the time. So we met and dated long distance, and I eventually moved down to Florida. So I, after again doing some volunteer work with the Ronald McDonald House in Jacksonville and Make-A-Wish, I found a child life job working in hospice, which has by far been my most favorite child life experience. And I piloted a program working with children of adult patients for the hospice program in Jacksonville.
Wow.
And after that, we moved to DC, where I worked at Inova Children's
Oh,
Hospital.
I worked at Inova. Did you? We talked about this. Did you? When did you work there?
So 2015 and 2016.
Okay, cool.
So I worked PRN, which was great. I got to experience lots of different inpatient and outpatient, coming from rehab and hospice, which are kind of, outside of traditional child life roles, I feel like. Getting that PRN experience of, several different areas was pretty amazing. In DC, we got our next set of orders, which was actually to Norfolk, which is where we are now. And we had planned to move, we went through all the motions. We were about to go down and look at homes with a real estate agent, and then got orders to Japan. So, yes. So that's where my child life career, sort of had to get creative, was when we moved overseas. So while overseas, I wasn't working as a child life specialist, but I kind of had more time, I guess, on my hands since I wasn't working, and was able to really do a lot of research and networking. And it was that time that I figured, okay, we've moved a few times now, and now we're overseas and I'm really not able to work as a child life specialist. How can I continue my work as a child life specialist, but also, have that work move with me? Because it's hard, to keep looking for jobs if you're moving every couple of years.
Yeah.
So, and that's how I connected with Andy from the Standish Foundation for Children. And she was interested in working with the military population. So fast forward to today, we are now in the Norfolk, Virginia area, and I have been doing some contract work with the Standish Foundation for Children. And we've started a program to support military-connected children and families that are hospitalized.
Oh my gosh, that's quite a journey.
Yes.
But if you think it's like every single experience that you build on just makes you a better, not only child life specialist, but we work in a field where it's like you just kind of can become a better person too. You're constantly evolving and working on yourself and working on how to support others. It's really valuable. But that's incredible, Lisa. I can't believe you're just like, oh, no, we went to Japan. I mean, I would have to up my anxiety medicine for sure, I think, if I had to deal with that kind of thing. But so props to you guys. I want to talk about military families specifically and what you guys do to support them. And so maybe, Savannah, you could talk about some of the key things you do. You talked a lot about transitioning and helping families transition. And what are the key components that you do for families in that setting?
For child life, we are trained in grief, loss, and bereavement support fairly extensively, and we also understand psychosocial stressors in and out. And for military families, they experience a lot of heightened stressors that civilian families and children just naturally will only experience once or twice in a lifetime, whereas military children and families are experiencing frequent moves, prolonged separations. Their system of support is changing all the time. And so as far as supporting children and families through my child life work, that's come about very naturally with the deployment cycle. And when I say deployment cycle, I'm talking about pre-deployment. So when you hear that you have orders to a new duty station, or you hear that the service member is going to be overseas doing some form of deployment, you already start to prepare a lot more of the natural things that would come to mind, like your budget, finances. Are we in a place where housing is where are our family? Are we going to move back to spend time with family while a service member is deployed? Or are we going to stay here? Those things are really logical and supported by the military. It's called family readiness. There's all sorts of classes that help prepare you for those types of things. But as far as helping you to prepare your child for what that's going to entail, those services and supports are few and far between. And so for me as a child life specialist, we do a lot of pre-deployment work during the deployment for support and those loss reactions that happen when there's that prolonged separation, and then reintegration. I've experienced both with my research and then also with families is there's a lot of stress that occurs with reintegration because we've all have established new normals, and finding those patterns of relating and rebuilding attachment after that separation, I can really step in and help support families in that way through play and just psychological preparation, as well as knowing what's normal and what's not, and when is it time to refer to a mental health professional. So my pre-deployment work is a lot of preparation and building legacy items that help connect the parents and the children together. So we've done memory making books, like we'll have the service member record a storybook, or we have what we all love in the military community is daddy dolls or mommy dolls, which are the service member. It's a picture of the service member front and back printed on cloth and then made into a doll. And so having that tangible item to stay connected has been really important for many families. And so those are just some of the ways, in addition to a lot of play and attachment building and having photographs of where the service member is to understand that they're not with us and this is what their life looks like apart from us. And some families I know like to do clocks around their house to know what time the service member is in and where are they on the map and things like that, just to prepare children cognitively and emotionally for what is going to take place. And then that support during, it is pretty typical to see behavioral changes in children and families during the deployment. So I help support them and work through that. And a lot of that is through play-based and relationship-oriented connections where we're working both developmentally grounded, but we're also working on those psychosocial needs.
Wow, what a huge impact you're making. It's hard to fathom that there isn't just a huge, totally well-funded program that's just already doing this, because it sounds like how do families even cope with this without you? I don't get it. I don't get it.
Well, Lisa and I are really excited to continue on that train.
Yeah.
There are a lot of supports and programs for military families, but the psychosocial part is really limited. And when you said that, I did want to bring to light the Focus project from UCLA. It's Families Overcoming Under Stress. They do work with families on more of those stressors and being aware of them and how to support your child through it. It's a set program that you go through, and it's free for all service members. It's on every military base as well. So in a way, there are supports. It's just as far as child life supports and services, those really aren't existing in the community-based setting on base.
Right. Just what you're saying is so important. And I'm wondering, before COVID, were you doing home visits and now you're doing virtual, or you're going in masked, or what does it look like for you right now?
COVID has changed a lot. What I'm doing now is virtual support, as well as if a family really wants to meet in person. We've actually done a lot outside.
Yeah.
So I'm wearing a mask, they're wearing a mask, and we're providing sessions outside, whether it's on the patio or, somewhere that's quiet and private, but still allows for us to kind of follow those regulations more stringently.
Yes.
And I've pushed a lot of resources as well, and following up with phone calls of how I can support parents to support their children, which is ultimately the mission of Child Life, is to ensure that the parents have that way to advocate and support their children the best way that they can, because they know their children best. So a lot of that has transitioned to more remote ways of engaging with families.
Wow, that's so interesting and so important. My gosh. Lisa, would you tell us a bit about what life is like for a military family that has a child with an illness, injury, or disability, and how it may differ from that of a civilian not in the military?
So I can't really speak personally, professionally to that, but I do know, just as a military family ourselves, that, going on base to the hospitals, some of the hospitals have, like when we were overseas, everything is on base at that hospital. So like your doctor's appointments, dentists, and, inpatient wards, emergency room, surgery, like everything is just all involved in one hospital. So it kind of depends on where you are, but depending on how many services the child may need, it may be all in this one hospital or, might be in different facilities. There is a program called the Exceptional Family Member Program, EFMP, through the military, that if a child has an illness or a diagnosis, they will be enrolled within that program. I'm not exactly sure how it works, to be honest. Savannah, I don't know if you know how that works, if you know more about the workings of that program, but I do know that that offers a lot of different support for the child and family.
So I can speak to EFMP because I have had a lot of experiences with it with myself. So Exceptional Family Member Program is available with all branches, and though they will not say that they can advocate for your family, they do provide a lot of transition support and availability to resources. So whether your child has an exceptionality or a diagnosis that's medically related or behavioral, and it's also for adults as well. So it's mandatory for service members to enroll their dependents, as we would call them, their family members, into the program. EFMP also does like outreach programs to help bring people together over shared experience. There was recently a House hearing about the EFMP. We say EFMP program a lot, but the P stands for program. EFMP, there was a House hearing on just the workings of it and the effectiveness. And so at this point, there's been a lot of talk about how EFMP can grow and be strengthened. And at this point, families don't receive psychosocial care from EFMP. It's more of the how can we work with families to help get them connected to the next duty station or education IEPs or those types of educational transition points. They can help with that. But as far as psychosocial, that's not a piece to EFMP. And then we also, yet. So caseworkers typically have a background in social work, psychology, and so they are available in that way. It just looks a little different. And then we do know that within TRICARE, which is the military insurance program, families can either be seen on base through military treatment facilities, or they can choose a different insurance route with TRICARE where they can see civilians providers off base. And so it's about 50-50 what families decide to do for their children. But we do know that military connected children have higher rates of special health care needs and behavioral health needs than do civilian children. And so just knowing that for child life specialists is this is an area that needs to be focused on, and that's definitely underserved because at this point there's about 28.5% of all children that are military connected have a special health care need. And that was found by the Children's Hospital of Pennsylvania's policy lab just last year.
Oh, wow. Yeah, that immediately would go to the top of our list, right? And even for practicing child life specialists now, if you have a military family that comes in, you can go in and do your psychosocial assessment, but that's important information for us to know that it may be a little bit more high needs than just a civilian patient that may come in.
Absolutely. Yes.
Lisa, would you talk a little bit about what your plan is and how you're working with the Standish Foundation and kind of what you guys would like to do and what other child life specialists can do to help support you guys and even parents that are listening? Because I know a lot of parents and listeners to this podcast, they feel like they get a lot, they receive a lot of support, and also want to look for other ways to support other programs. And I think this is really worthy. So can you talk to us about your experience there?
Sure. So far for our 4 Mil Kids program through the Standish Foundation for Children, we have focused on supporting child life programs within military treatment facilities. So as much as I've researched and Savannah and others, what we've found is that there's 3 child life programs within military treatment facilities. So of all the hospitals that are on bases or associated with the military, there are only 3 child life programs, and they're, of course, 1-person child life programs. Wow. So one is in Hawaii at Tripler Army Base, and another is actually here at the Naval Medical Center in Portsmouth, and the other is at Walter Reed. So, like I mentioned, so far, we have just been supporting these child life programs that exist currently, thinking that this would be our best bet for getting a foot in the door, where there's already a child life presence. We've done a lot of brainstorming and trying to figure out how best to get things started or get the ball rolling. The military treatment facilities can be tricky to get donations and other things. There's a lot of different hoops to jump through, and a lot of people and just items that need to be checked off, I guess, before any kind of donation or working with kids in the military treatment facilities.
Sure.
So like I mentioned, we've just been focusing on supporting these existing child life programs through donations mostly. So providing cloth dolls for the child life specialists to utilize, and just providing some other arts and crafts materials, board games, playroom items, things of that nature. So
yeah, when they don't have to worry about that component, they can really focus on their job and growing what's inside that. So the fact that you guys are doing that is huge.
Yeah, it's been a little tricky, like I said, but we're happy to be able to support these programs. So certainly providing items and support to the existing child life programs is a way to provide support. That's kind of as far as we've gotten, honestly. Like I said, we've brainstormed about a lot of different ideas. Making them happen is kind of a different story. So
right. That's really incredible, though, and really important work. So you guys mentioned a couple of the programs that military families can reach out to, but since there isn't a big child life presence in a lot of the medical facilities within the military bases, what are some of the few things you would tell a military family who's going into their first military medical experience? Like what are some things they can do to prepare for that may be different than a typical civilian experience?
I come across this a lot with families. First off is if child life is available, you can request and see if the child life specialist is available to come at least meet with you and help prepare your child or support you during that procedure. Though it is 1-person programs and they have a really large patient population to serve. So just keeping that in mind, but also knowing that right now with COVID, military treatment facilities, as well as most civilian hospitals, are allowing 1 caregiver in at this time. And I just want to recognize that's really challenging for a parent. Yeah. And so knowing that self-advocacy is an exhausting thing, and saying like working to advocate for yourself, yes, that's a big component of military families, is they very much learn how to advocate for themselves to be resilient. And so going in, I would say reach out to maybe someone in social work or someone in psychology. Those are more accessible psychosocial professionals that are going to be in every military treatment facility and most clinics. And then also there's a pilot program called First Steps that the Department of Defense is looking to integrate. And that would be a marriage and family therapist or a licensed counselor that's going to be available within the pediatric clinics that you can reach out to for developmental support, psychosocial resources, questions about what military family life has been like, and stressors that are been overwhelming or have impacted your child's development. And so looking for that as well, just in your well child visits. But going in, knowing that advocating for yourself is going to be a big part of how you receive quality and continuity of care, but also knowing that you can reach out to Lisa or I in any way to get that support you need. We have a large network of child life specialists that are military connected. It's our network that we've developed. It's Military Child Life Collective. And we have child life specialists throughout the United States and internationally that are more than happy and very willing to support families through their medical journey. Whether we can help support that child life specialist in providing services privately, or to work with some of the volunteer programs in the military treatment facilities to make sure that child life is available to you. There's over 55 child life specialists in our network at this time. And Lisa and I are really looking to expand that through hopefully nonprofit work in the near future, and partnering with Standish Foundation as well. Lisa, do you have something to add for families?
I would just say, speaking from the personal side of things, as a mom of 3 children, I have been to many different military treatment facilities. Luckily, not for any hospital stays, but just for appointments and things. The number one thing I would recommend is to come prepared with comfort items and things to keep your child busy, because actually, I was in the ER somewhat recently with my youngest, which was completely fine. It wasn't an issue. But we were there for hours, which isn't any different really from, a civilian experience. But if you, say have to pick up a prescription, if you're at a military treatment facility for an appointment and then have to pick up a prescription from the pharmacy can literally take hours, just the system that they have in place there. Yeah. So, a trip to the doctor's office in a military treatment facility is at least like a half a day to almost an all day experience.
Wow.
So again, just, come prepared with comfort items, things to keep busy, things like that. Just knowing that you may be there for longer than you think. And also, one thing I wanted to add about the military treatment facilities, which is great knowing that, military families move quite a bit. If you are seen at the military treatment facilities, the medical records will follow. They'll have all of the information from all the different military treatment facilities, which is nice. What makes it complicated, though, is if you are seen in a civilian practice or a civilian emergency room, hospital, then that may not necessarily be in the medical record that was, included on the different military treatment facilities. So going on what Savannah said, advocacy and being prepared would be it's good advice.
I love that. It's like the binder will never not be a great way to keep track of everything. Like, things are just in so many different places. And part of advocating too is asking, like, here's my email, send me the name of this diagnosis. I can, what I mean? Just asking those questions and, keeping it together. If you are going back and forth to different hospitals, if you're living on a military base and you go in for a quick ER visit, but you're also seen at this hospital, just ask for what you need. And they can give it to you. They can find ways to give it to you, even if there's a little bit of pushback at the beginning. Just keep asking the people. One nurse may give you a different response than a doctor would, and vice versa.
Yeah.
So always ask. What else? Yeah, please go ahead.
I will also add, at military treatment facilities, you have Red Cross volunteers and chaplaincy that are going to be great resources as well. And building off what Lisa said, bringing a bag, that's actually something I did with a few families when I used to go into military treatment facilities with them before COVID. We would bring a blanket that we could spread out onto the floor and have play items and distraction items. So if you know that your child is getting a vaccination or coming in for a well child visit, like Lisa said, bring in a bag and have it with comfort items like your children's favorite teddy bear or stuffed animal, be able to wash that blanket afterwards, and have distraction toys and look and find books. Especially with vaccines, I know with military families, vaccination seems to be something that's a heightened stressor. And I do believe that comes from, we just naturally don't have as much support whether it's military corpsmen that are more like the nurses in military treatment facilities for Navy and Marine Corps, there's just not a lot of pediatric knowledge that comes from that training, because they're trained to support active duty military in a combat zone.
Right.
And support them during deployments with more of those medical needs. So they're more trained for adult care. And so pediatric visits and vaccinations can be a stressor for sure. So I teach parents to utilize Buzzy Bee, to have distraction items, and utilizing comfort holds. And so there's great resources from the CDC and with other Child Life, like Child Life on Call. I know you have a comfort positioning and vaccination resource. And so coming prepared, I usually give families the CDC pamphlet on vaccinations with comfort holds and breastfeeding during vaccinations. And you can hand that to your nurse or corpsman and explain, this is my child's coping plan. I would like to do a comfort hold and also breastfeed my infant during this vaccination. And that's that piece of advocating for yourself. And like I said, advocating for yourself can be really tiring. And that's one reason why Child Life was developed, to advocate for children and families.
We'll do it for you.
So we will do it for you.
Yes.
Or we can support you before going into that appointment. And hospitalization-wise, I will speak kind of going back to, what is it like for military parents and children who are hospitalized or have a medical condition? Continuity of care is a really big stressor, because if you think about it, we're moving a lot, whereas civilian providers are going to be available to you if you live in an area for 15 years, you develop a great therapeutic relationship with your provider, those nurses, the child life specialist, the social worker, all of that component that is all there for a very long time, and you receive more quality of care because of that. Whereas not only do we have military families who are frequently moving, but a lot of them decide to do something called geo-bacheloring, which is, instead of moving with the service member, they stay in one place to receive better care and education. And that's a really hard thing to realize, is that's
a hard decision to make.
Right, are choosing to live separately in order to get better care for their children. Wow, that's a sacrifice that we definitely acknowledge is a pretty significant weight, but also knowing like you're advocating for your child in that way. But then we also have the providers themselves in military treatment facilities and clinics that are frequently moving. So that's something I've experienced is with my autoimmune condition, is that I every 6 to 9 months have a new provider, and I have to go over my history and why I'm seeing all of these other specialties. And a lot of times I don't want to go in and get care because I know how much work it's going to be. So I know that families also experience that, as well as with new providers changing over. It can be really a challenge. So with myself, I have an autoimmune disease. And so I've also experienced what it's like to not have continuity of care and how that impacts the quality of care you receive. And so when I have new providers every 6 to 9 months, that can be a really arduous task, and it keeps me from wanting to go in and makes it harder for me to be able to advocate for myself, especially with all the referrals and specialties that I coordinate. So it goes back to self-advocacy. One thing that I've found that's been really helpful is actually having a document that's like a living document, where I always have my symptoms list and medication that I'm taking and the providers I see and what types of imaging, or what are the dates where I got an echo, or what are the dates where I got an x-ray, and kind of giving that to new providers has really cut down on me having to self-advocate or re-explain things that I know are already in the chart. And so once again, going back to that binder, maybe even having that living document available on your phone or on your computer that keeps track of your children's symptom lists, of when it started, or when it went away and why, or what the date of onset of symptoms were, and what kinds of medication and treatment they're receiving now. has been something I've noticed has been helpful for me. And I've advocated for a lot of adolescent patients that I've worked with. So that's another piece that can be helpful for families who are experiencing a lot of stress with what's going on with their diagnosis of their child or for themselves.
Yeah, that's huge. And I love that advice. And even if you're not a military family, that's just good advice to kind of keep track of everything. Lisa, would you tell us if we or child life specialists were interested in helping support you guys in your program? Or, I think we're all looking for jobs sometimes, in the child life field if you're not living near a city, but maybe there is a way that you can support children in military families. Or military families or parents who would like to receive support. You mentioned kind of your collective group. What's the best way to get in touch with you guys?
So as Savannah mentioned, we are hoping to pool all of our resources and further our networking group, as well as providing child life services to military connected children and families. So we don't really have anything formally put in place yet, but we do, contacting Savannah or I think by email would be great, and we can reach out and, try and figure out how we can best support these children and families. And like I mentioned earlier, through the Standish Foundation for Children, we are taking a step back at the moment just to regroup and figure out what our next move is. Like I said, we've just been supporting the 3 current child life programs that are in military treatment facilities, but we're only looking, for the next steps for that program and how to best support children, military connected children and families. Also, Savannah mentioned earlier, and I've done some volunteer work through the Red Cross, but I'm pretty sure mostly all of the military treatment facilities, they have Red Cross volunteers. So that's another way for people that are interested in supporting military connected children and families is through the Red Cross. And oftentimes they'll have a Salute to Armed Forces program, which is specific to military children and families, and providing either, playroom type items, toys, arts and crafts supplies. Sometimes they'll have like an art cart or a book cart or something that will go around on the children's wards. And they do offer some different programming, I know, through the Red Cross.
I love that. Well, I will definitely include both of your emails and contact information for military families to get in touch with you. And I love the idea of the Red Cross thing because you guys are busy building stuff and creating about ways to do this. So if parents or listeners or child life specialists are really interested, that's one way that they can get involved. And I love that.
I do have another
yes.
option as well. So
Yeah.
I almost forgot. But the Fisher houses, which I'm not sure if you're familiar, are similar to Ronald McDonald houses, but only for military families. So military families that have a child or family member that is in the hospital can stay at the Fisher house, and they, similar to a Ronald McDonald house, have different kinds of supports available. And thinking along the lines of people wanting to help out or offer time or services. I know that the Fisher houses, they're not currently accepting donations now on account of COVID, but can accept donations, as well as have, groups or families or just an individual come in and cook dinner or, provide food for different meals and things like that.
Thank you so much, Savannah and Lisa, for all of the information you shared. I know I learned so much that I'm embarrassed to say I had absolutely no clue about. So thank you for letting us know about the different ways we can get involved, the different ways that child life specialists can be supporting military families, and so much more. I'm going to include all the good information that they want to share with you on the show notes page. So if you want to check there for any resources, please feel free to do that. Also, I'll do my best to share it all on Instagram and Facebook so that you guys have an easy way to find it. I'm looking forward to sharing more stories from military families and want to thank you so much for listening. I'll see you soon.